Welcome to the Healing Wellness Show. I'm Dr. Cream. Today we've got Amanda again with us. You've probably heard a lot of buzz about like Ozempic, Wegovy, Manjaro.
Wegovy.
There you go. Wegovy, Manjaro. But what's the real story behind these GLP-1s? So a lot of people are using them for weight loss, but today, we've got Amanda, the nurse practitioner. She's going to dig deep, give us a little bit insight about, is it just for weight loss? Is it for anything else? But yeah, I want to welcome Amanda here with us today. Last two times, I guess, you've talked about the blood work and hormone therapy.
Correct.
Right. So today we're just going to dive into this topic, GLP-1 medication for weight loss. So for those who don't know what exactly we're talking about, well, we'll leave the mic to Amanda. Tell us what GLP-1 is all about.
Yeah. So like he said, kind of some of these clinics are, it's kind of getting advertised as the skinny shot or the weight loss shot. It is a lot more than that. You hear the GLP-1s. There are some dual agonists, GLPs too. GLP-1 essentially just stands for glucagon-like peptide 1. It's a receptor agonist. It's basically just a natural occurring hormone that's excreted in the gut, and it just helps the body regulate blood sugar. So typically it's released after a meal. So it helps with increasing insulin. It actually decreases glucose secretion, and it helps with slowing gastric emptying, which is what's going to be the key in that fullness or that feeling of, like I said, full or just the increased satiety. So they work really well for patients trying to lose weight. But the research is also showing that there's some indications out there for patients who struggle with addiction, whether that be drugs, alcohol, smoking. So they do decrease not only appetite, cravings, but also have some of the helps with the addiction too. So that's been very beneficial as well.
So what's the difference between these medications and, fad diets?
So like he said, there's many different kinds. Semaglutide. There's compounded versions. Obviously, your Ozempic, Mounjaro, those are going to be your brand names. We use primarily the compounded versions like semaglutide or tirzepatide. They all work very similarly. I would say the biggest thing that I've been hearing is the tirzepatide maybe has a little bit better component as far as weight loss goes, maybe a little bit less side effects. But I have patients on both, and they tolerate both well. I mean, if we need to transition one from the other, we can do that too. It really just is based off how the patient tolerates it.
So who's an ideal candidate for this?
Yeah. So really anyone who, is overweight or struggling with weight loss. But again, also patients who are struggling with maybe smoking cessation or alcohol abuse, patients who are at risk for diabetes, hypertension, hyperlipidemia. So really it's looking at the whole picture. Again, meeting the patient where they're at, finding out what their goals are. But very rarely will I turn someone away for trying to get healthy essentially. And I think it comes with, not just the shot, but kind of a whole picture too.
So you hear a lot about these are meant for diabetic patients. So is this safe for someone that wants to lose weight or some other condition?
Absolutely. So you don't have to have diabetes to begin this. Really, it comes down to insulin resistance, which is a large problem today, which is what's causing all of the issues with obesity. Insulin resistance presents itself in many different ways based on your genetic phenotype. So yeah, it's way more than diabetes. It's really just about getting these patients healthy, helping with anti-aging, longevity, that kind of thing.
So what kind of tests or initial things that you have to do before putting someone on one of these?
Yeah. So the biggest thing is the contraindication are if you have a history of medullary thyroid cancer, you are not, that is contraindicated. Also with multiple endocrine neoplasia syndrome type 2 is the other contraindication to this, which again, we don't really see a lot of, fortunately. Those are really the only contraindications. Obviously, the side effects of nausea, constipation or diarrhea, indigestion, those are all talked about up front. Obviously, if a patient has issues already with constipation, we're going to talk about ways to prevent that. And, same thing with if they have issue with GERD, we're going to talk about that beforehand and kind of come up with a plan as they incorporate these.
So what kind of results have you seen with, like, in your practice with these patients, especially for weight loss?
Yeah, so I mean, we've seen excellent results as far as with weight loss. We're decreasing patients' A1Cs, which is very important. We're improving lipid panels, blood pressure is decreasing, helping them get off medications. So I mean, it's been awesome. These patients feel good. They have their life back, so with the weight loss, kind of just a domino effect as far as their health. The other important thing to know is that you'll hear, patients with, the decrease in muscle mass is a big one that patients ask. And that is definitely a valid concern. So again, it's talking about ensuring adequate protein intake. A lot of my patients are doing hormones too, so the testosterone is going to help maintain that muscle mass. Also, resistance training is another way to maintain that muscle mass. So we're having these conversations. I'm seeing them at least monthly. We're doing body composition testing so I can make sure that we're not losing that muscle mass because it's very important.
So how soon would you say patients are starting to see results or losing weight, and how many pounds are you talking about? Like, say, each week or each month?
Yeah, so obviously everyone's different, but typically the change in the appetite, from experience, I'm seeing that start to happen within probably a couple weeks. And then the weight loss is obviously going to follow that as you have a calorie deficit. So average, they say about 4 to 6 pounds a month for women, 6 to 8 pounds for men per month. I have seen more than that though. So it's really just everyone's kind of their own entity. And so we make goals together and just kind of work through that together. And that's why I think it's important to go to, a place like Iowa Wellness where you have someone monitoring you and helping you through this and educating you, because, people are finding these medications, on a Google search, and that gets kind of scary.
Do these medications affect, I know you talked about blood sugar. I think you mentioned cravings maybe and energy?
Yeah, so there actually can be, I've seen both, maybe a little decrease in energy, maybe at times. There's really no issues with blood sugar as far as becoming hypoglycemic. If patients are on multiple diabetic medications, we'll have that conversation, but they will not cause hypoglycemia. But yeah, cravings. I have a few patients on it for smoking cessation, and they definitely have noticed a decrease in their cravings for that. So,
do you use it for any other cravings or addictions?
Yep, alcohol is another one. Alcohol abuse or drugs, any drugs for that matter. It's going to help. It works in the brain, so it's going to help the body turn off that sensory to kind of feed that addiction.
So addicted to donuts.
Yeah, exactly.
So are these medications just alone enough, or does lifestyle still matter?
Absolutely. So, it's the whole picture. So yes, we're constantly talking about diet, exercise, gut health, because no, you cannot just take the shot and expect that to kind of be the end all be all. So it's, again, talking about these things early, setting realistic expectations, and then talking about these habits continuously as they're coming into the office. So it's definitely a comprehensive approach.
So how do you support these patients with all these things you're talking about? Like, what does that look like?
Yeah, so at the initial consult, we're talking about gut health. We have a really good gut health program here at Iowa Wellness that's essentially kind of like an elimination diet, kind of repairing the gut and rebuilding it, if you will. So we're talking about that. We're talking about lifestyle, interventions such as sleep and stress, because all of those play an important role in how well they're going to respond to this medication. Talking about, getting a good health history is important. Also talking about what other medications they might be on. But really the big thing is going to be, how can we fix them from the inside out? The GLP is just kind of an added bonus, but really it's looking, working from the inside out, finding that root cause, and then really it comes down to just fixing the gut, decreasing the inflammation.
So would you say GLP-1s, are you using those like long term, or is that like a short term until you fix things and then, you have a plan B for them?
Right. So really, I think when we first started using these, it was, let's lose weight really fast so that we can hurry up and get off the medication. But the literature is actually showing that these medications long-term are safe. In fact, they're decreasing the risk for cancer, Alzheimer's, heart disease, stroke. They're decreasing blood pressure, helping improve lipid panels. So from an anti-aging longevity approach, they're not all bad. I think the biggest thing is the financial burden, but if patients can, are able, then we encourage them to stay on that, even if it's just doing like microdosing. So, microdosing is what you'll hear quite a bit about when it comes to these GLPs. And it looks a little different for everyone. So whether that's decreasing the dose once you've hit kind of your goal weight, weaning down off that dose and maybe just do small doses, once a week, or, increasing the interval, maybe doing a small dose every 10 days or every 14 days, whatever the patient feels comfortable and can do. We will have that conversation once they kind of get to that maintenance phase.
What are like some side effects that?
Yeah, so like I mentioned, I would say the biggest one's going to be nausea, constipation or diarrhea, heartburn. Those are honestly the big ones. I do encourage my patients to drink plenty of water because you do have a little bit of risk of dehydration, which can affect kidney function. But, fortunately, I don't see this, being an occurrence most of the time. And a lot of these side effects, are preventable because we start the dose very, very low and we go very slow as we, when it comes to titration. Starting low, going slow, I think is key to everything. And I think it really helps with the side effects.
Is there any long-term risks that people should know about?
I haven't seen it. Like I said, I think just being safe and dosing properly and just providing that education and following your patient closely. I check labs before I start the medication, and then I'll recheck labs, 3 months down the road, 6 months down the road, yearly, whatever it needs to be. So I'm following these patients closely, and most of the time we're seeing improvements in all of these things. So it's good.
So how often are you seeing your patient? I know you just said about the blood work every 12 months or so, but how often are you seeing your GLP-1 patients?
So at least monthly. I want to see them monthly so that I can make sure I'm intervening as soon as possible if need be. So, and then like I said, checking the body composition levels, making sure we're losing body fat, not muscle, and then making sure I'm addressing, any nutrition, needs that might need met or changed, checking in on gut health, checking in on, like I said, how's your sleep, how's your stress going? It's just nice to have that conversation. They feel heard. And so they're more prone to, they want to continue coming to you because they trust you. So it's at least once a month.
And then do you incorporate the GLP-1s with other services at Iowa Wellness? I know you mentioned gut health, but anything else that?
Yeah, so I think gut health's a large one. I think the other most important one is going to be hormones. So I do a lot of the GLBs at the same time that I'm doing their hormones because, like I said, that testosterone really helps maintain that muscle. And they just work differently. If patients' main goal is weight loss, I'm going to probably go the GLP route, but I'm also going to be talking to them about hormone optimization and checking for vitamin deficiencies, and thyroid's a big one too, as we previously talked about, making sure that all of these things are optimized so that they can all work together to make the patient feel their best.
So what makes your approach or the Iowa Wellness Center different from any other weight loss clinic out there, or weight loss clinics that see at the hospital, or anything else that just hand you meds or
right,
give you diets to follow? What's the difference?
Yeah, I think we follow our patients very closely. So it's not just here's your shot and we'll see you later. I'm calling these patients, after the first 2 weeks of being on the medication. They know that they can call at any time, regardless. So I think just having that person that can guide them, they don't feel alone. I think really that's the biggest thing. And I think we do a really good job of following up with our patient, helping them achieve their goals. It's just that strong relationship that we have with our patients that really sets us apart from, just here's your vial, here's your syringes, good luck kind of thing. It's, that's important.
So what's one thing that you wish everyone out there understands about like medical weight loss and GLP-1s?
Yeah, I think they just have a bad rap. I think patients just sometimes feel like it's kind of a crutch, or like, I can't do this on my own. I'm going to, take a shot and, I'm going to get skinny kind of thing. So it's way more than that. It's, a lifestyle change. It's making a lifestyle modification. So it isn't isn't just a skinny shot or I'm going to take this shot and lose a bunch of weight, that kind of thing. There's a lot more to it, like I said. And so I just encourage patients interested to come on in, have a consult with me. We'll kind of explore where they're at, where they want to be, see if the GLP would be right for them. Maybe they don't want to incorporate that at first. Maybe they want to do, start with gut health. So really it's just finding out where they're at, and then how we can help and what we can incorporate to help them achieve their goals the fastest and the safest.
Would you say you have any patient testimonials that you can share with us?
I have one lady in particular that sticks out. She's been on the GLPs for a couple years now, and she's completely transformed her life. She's lost about 80 pounds. She feels good. She can exercise now. Her anxiety is gone. She's no longer depressed. She has energy. Her mood's improved. So every aspect of her life with her relationships and everything has improved. And she just, every time she comes in, she just she breaks down and she just thanks me for helping her change her life and get her life back. And so it's pretty awesome to see that.
So what would you say to people that are wanting more information about this or want to come and see you?
Yeah.
How do they do that?
So yeah, just give us a call at Iowa Wellness. Schedule a consult with me. It'll be either myself or our social worker, Angela. We'll sit down with you. We'll kind of peel back the onion, if you will, kind of figure out where we need to start, see if GLPs would be a right fit for you, see if gut health, hormones, and then, to go from there, we just start with a blood draw. I do a blood draw on everyone. So the blood draw, and then from there, we can figure out which direction we need to go from there. So very easy.
Thank you, Amanda.
Thank you.
Well, thank you, Amanda, for joining us today at the Healing Wellness Show.
Thank you.
We'll probably have you again. I think our audience are enjoying all the information you've given them for the last few that we've done in today's show. So
Awesome.
Thank you.
Love it.
So if you've tried every diet and feel like nothing's worked, you're not alone. There are real science-backed tools to help. The medical weight loss program that Amanda talked about goes beyond the scale to help you feel good in your body and reach out. Feel good in your body. So go ahead, reach out. Iowa Wellness Center, like Amanda said, the team there will, I think what you said, offer them a free consultation.
Correct.
They'll offer you a free consultation. Go see Amanda or one of her team leads. So go ahead and do that. It will be on the screen with the phone number. And yeah, anything else, Amanda, that you'd like to share?
I think that's it. Thank you for your time.
Thank you. I'm Dr. Cream here with the Healing Wellness Show, and I'd like to thank you for joining us today. And tune in for next week's episode and follow us on all social media platforms. We'll see you soon.